Yeah.
Hi, this is Luke Cutinello,
This is David Gordon.
This is Brianna Hess.
and this is our pandemic preparedness plan for an independent living facility. So, a little bit of general background. Independent living facilities are commonly associated with assisted living facilities. However, they are a lot less labor intensive. Staffing is not consistent across the board. The more expensive the facility, however, the staffing numbers are typically a lot larger. Most facilities are unlicensed and do not have staffing requirements. This results in a wide variety into who is staffed and how the staff is trained. So paying for these services, costs vary and again are very dependent on location and the services needed. Independent living services cannot be covered for by Medicare or Medicaid. Therefore, they must be paid for out of pocket, either by the consumer or the consumer's family. This does pose a threat over a long extended period of time as to how well they can pay for these services. So some of the services provided, because most facilities are for those that can still live on their own but do enjoy aspects of community living. This is why they are unlicensed and do not have certain requirements, because they are not providing essential services as do other long-term care facilities. So some of the facilities, some of the aspects of community living that they implore are group activities, housekeeping, dining, and transportation. It's very similar to living in an on-campus apartment or residence at a university. So some of the changes with today's pandemic and pandemics that may occur down the road, particular to COVID, as COVID affects many older individuals, group activities and close contact among individuals must be extremely limited. If applicable, if these places do have dining operations, the dining procedures would have to change drastically. Any assistance that requires in-person contact would also require procedural adjustments. This is just in order to help reduce exposure and continuation of a virus, in particular COVID spread.
All right, to talk about some supply chain threats. Without a clear plan of action or communication, the supply chain and the facility will begin to crumble in disaster. There's evidence of this in the past from different threats such as Katrina or pandemics such as SARS earlier, and now of COVID-19. Each environment and facility is going to require a unique response and a unique solution to everything. However, a community-based response for general guidelines, such as in St. Louis, allows for quick action and quick guidance towards these solutions. Some examples of threats and responses: if a facility offers food or dining services, food delivery might be compromised, whether it be the food be compromised or the driver and everyone unloading it might be infected as well. Staff may become infected and cannot treat anyone or offer services due to the pandemic. Some responses that you could actively screen residents and staff coming in and coming out of the facilities to help prevent the spread. Subcontracted staff might not be communicating to their uh, contractors as well, causing some miscommunication and services not being fully offered. It was found in the last 3 years, 61% of independent living facilities were cited for lack of infection control. So this is a real threat.
So this is an example of the communication plan that we would implement in an independent living facility. The first step to any emergency preparedness plan is to plan ahead. This would include updating patient records and facility records, practicing responses to these emergencies, and brainstorming these scenarios. One of the main reasons why responses to COVID-19 were a little bit shaky is because nobody thought something like this would happen in this modern age. The second step to this communication plan is to know the stakeholders and how to reach them. This would include multiple ways of contacts, whether it be phone, email, or fax, just to ensure that if one of those methods goes down, there is another way to reach these stakeholders. And also keeping digital and hard copies of these contacts just to make sure that they are able to reach in case there's no electricity or anything like that, and also putting them in an alternate location if the facility has one of those. The third step to our communication plan would to be develop a official statement dissemination plan, just to make sure that all the stakeholders are getting some sort of information and that it is being approved by one person to make sure that the information is appropriate and doesn't cause any sort of speculation or room for rumors. Lastly, and probably most importantly, is to maintain the quality care. You want to make sure that even though there is an emergency going on outside, that you are providing the best care for your residences and their families and the stakeholders. So this would include honoring the confidentiality of your residences, avoiding speculation from staff or the patients and their families, and keeping stakeholders involved to make sure that nobody is left out of the loop and up to their own imagination as far as what is going on within your facility. This is just an example of how we would delegate some communication within the facility. You don't want to have one person in charge of speaking to all of your stakeholders, because that would get really overwhelming and could lead to some mistakes. So making sure that the people within your facility are reaching out to the stakeholders that are most relevant to them ensures that communication is going smoothly and the information is being spread appropriately. These are our references.
Thanks for watching.